Hello, everyone. My name is Carl Rasmussen, and I did my project on kidney cancer in honor of my uncle. He just recently passed away. And it basically is an abnormal growth of cells in kidney tissue that in time form a mass called a tumor. These are the topics I'll be covering, and let's get started. So the etiology, unfortunately, much like other cancers being researched today, the actual cause of cancer is currently unknown. There are indeed several risk factors that can increase the chances of contracting the disease, but it does not mean that you will, because even people with few or no known risk factors have also been able to contract the disease. People who smoke, are overweight, have hypertension, work with exposure to certain substances such as trichloroethylene, their gender and hereditary risk factors all play a role in contracting this disease. Hereditary kidney cancer is very rare and accounts for only 5 to 8% of all kidney cancers and is usually linked to a hereditary syndrome. At least hereditary kidney cancer is often diagnosed in the early age than sporadic kidney cancer, which means the treatment can get to it quicker and possibly even be cured. And the mutations in several different genes is what causes the hereditary syndromes that increase the risk of kidney cancer. A kidney only needs to inherit a single mutated copy of a gene to have this disease because it is an autosomal dominant inheritance. People who have multiple family members with the disease go under a process of analyzing cells or tissue to look for changes in the genes, chromosomes, or proteins that may be a sign of the disease. This is called genetic testing, and it may help assess risk. One mutation in kidney cancer affects the VHL gene that is also called the tumor suppressor gene, and that normally prevents cells from growing and dividing too quickly. But due to it being an autosomal dominant, if one parent has VHL, then there's a 50% chance that a child will also inherit this mutation. And the demographics for kidney cancer is that it's one of the most 10 common cancers in both men and women to be contracted. And the people who do contract this disease are usually much older, with the average diagnosed age of being 65, but can also keep going to 75. And it is very rare for people to be younger than 45 to get this disease. But it is also 2 times as common in men rather than women. About 2% of the male population versus 1% contract this disease. The mortality rates of kidney cancer are much higher in less developed countries rather than more developed due to the prevalence of risk factors that come with the rapid development and higher productivity, such as smoking, obesity, hypertension, and physical inactivity. Countries such as Brazil, Ecuador, Thailand, and Bulgaria were among the countries who saw a sharp increase of incidences, while Sweden, Denmark, and Western Europe, as well as Australia, saw a decline in incidences. And this is a diagram of the kidneys and the arteries and things that it is connected to, because the kidneys itself is a pair of bean-shaped organs on the side of our spine, below our ribs and behind our belly, maybe about the size of a large fist. And the kidney's job is to filter our blood. They remove waste, controls the body's fluid balance. It keeps the right level of electrolytes. All of the blood in our body passes through them about 40 times a day. And the blood comes into the kidneys, waste gets removed, salt, water, and minerals are adjusted if needed. The filtered blood goes back into the body, and waste turns into urine, which collects in the kidney's pelvis, which is like a funnel-shaped structure that drains down a tube called the ureter to the bladder, where it can be excreted. In kidney cancer, there's multiple stages, and unfortunately, most people do not even know it until they're at stage 4. But anyway, in stage 1 is when the tumor is at 7 centimeters across and smaller, and is strictly only in the kidney. So it hasn't spread to any other lymph nodes or tissues. And lymph nodes are basically small little filters that trap germs and cancer cells, and store infection fighting cells. The tumor in stage 2 is when it becomes larger than 7 centimeters across, but it's still only in the kidneys and it hasn't spread to the lymph nodes or any other tissue yet. When it comes to stage 3, the tumor has spread to the major blood vessels, the renal vein and inferior vena cava, or into the tissue surrounding the kidney, or to the nearby lymph nodes. And stage 4 is when it's spread outside of the kidney to the adrenal gland, and it just spreads from there, from the distant lymph nodes to other organs, because it goes with the blood, and the blood goes everywhere. The physiology and symptoms in kidney cancer, it is not noticeable in the body until it's at about 10% normal function, and that could lead to blood in the urine or lower back pain in one side of the body. Other symptoms related to kidney cancer affecting the rest of the body include fatigue, loss of appetite, a noticeable lump on the side or lower back, swollen lymph nodes, unexpected weight loss, fever, and low levels of blood. Kidney cancer can progress and spread to other areas of the body, such as bones, lungs, or the brain. Cancer cells get into blood vessels, and they can travel to many parts of the body through our veins and arteries. And the lymph system is a network that runs throughout the body, much like our blood vessels, and it helps you fight diseases. But if the cancer cells get into the lymph nodes, it can hitch a ride to the rest of the body and other organs. The rate of new kidney cancers has been rising since the 1990s, though this seems to have leveled off in the past few years. This rise is probably due to the use of newer imaging tests such as CT scans, and which picked up some cancers that may have not been found otherwise. And they suggest that because the mortality rate has not increased, just the detection rate. And basically, they suggest that roughly almost 14,000 people will die from this disease annually, twice as many men than women, and that give or take 79,000 new cases of kidney cancer are also diagnosed annually. Different ways to get diagnosed for kidney cancer would be urinalysis, which is testing of the sample urine for traces of blood that's invisible to the naked eye. There's blood test counts, the number of each kind of different blood cells, as well as look at the different electrolytes in your body, basically to see if the kidney function is impaired, or maybe you have too few red blood cells, which is referred to as anemia. And CT scan is a special X-ray that uses a computer to create a series of images or slices of the inside of the body. MRI, which is a magnetic resonance imaging, is also a test that produces images inside the body, but uses a large magnet, radio waves, and a computer instead. Ultrasounds, another AI that helps with creating images displayed on the monitor, through high frequency sound waves. And renal mass biopsy is a thin needle inserted into the tumor, and a small sample of your tissue is removed. And a pathologist will look into the tissue under a microscope to see if there's any cancer cells that is or not, to see if there's any cancer cells, but it is not recommended because it is considered unreliable. And cancer treatment depends on the stage and the grade of the tumor, as well as the overall age and overall health of the patient. The treatment options for kidney cancers include surgery, ablation, radiation therapy, targeted drug therapy, immunotherapy, and sometimes chemotherapy. Radiation therapy and targeted drug therapy is used for patients who are not eligible for surgery and is used for treating cancer symptoms such as pain. If kidney cancer is detected before it breaks the covering of the kidney, then it is most likely curable. The side effects will vary based on the length of the treatment and the health of the individual, but common side effects include fatigue, diarrhea, weight loss, hypertension, fever, weakness, muscle aches, vomiting, and loss of appetite. And that concludes my presentation.